Tim, thank you so much for joining me today. I really appreciate it. I was wondering if you could just start by introducing yourself and giving us a bit of a background of your Waldenstrom's diagnosis.
So my name's Tim Ferris. I have to have a company medical every year, and this started for me when one of these medicals came back with some blood tests which looked a little bit odd to the GP, and she said, you really need to go and get this checked out. So I went off and had various other tests, and eventually it came back as Waldenstrom's, which was something I'd never heard of before and didn't know quite what it was all about. But obviously the consultant explained it to me, and I was able to do a little bit of reading up on it as well.
Amazing. And when was it that you were diagnosed?
So I think it was about 2.5 years ago now.
2.5 years ago. And have you needed any treatment since your diagnosis?
No, I haven't. I've been on active monitoring since that diagnosis.
Okay. And how did your consultant approach that conversation around active monitoring with you when you were diagnosed?
He was at pains to explain that it's a very slow developing condition, and that it could be many, many years before I need any treatment, but they do obviously need to keep track of how it's developing and assess progress. So it was explained that I would just come back for blood tests every 3 or 4 months, and literally keep an eye on it.
And how did you feel when they first sort of told you that they weren't necessarily going to treat this cancer, they were going to pop you on active monitoring?
It kind of runs counter to your expectations, because I think that the kind of the cliche is that they say, oh, we've caught it early, so we're going to do something about it and get rid of it, and that's all going to be fine. So it's quite different to that. And I'd never heard of this kind of thing before, of having no treatment but just active monitoring. So it was a little bit unexpected, I guess. I mean, the whole thing was unexpected, but the consultant's plan to just monitor it was also unusual. But I mean, personally, I was quite happy in the sense I didn't really want to have any treatment. Yeah. So it was nice to be able to postpone.
And so obviously that was 2.5 years ago now. Mm-hmm. How do you feel sort of emotionally about active monitoring now, or how do you feel like you cope with being on active monitoring now?
I think it's something that you can just park to a large extent for most of the time. When it comes up to the point of your next blood test due, it will be on your mind a little bit, and you kind of want to just I guess be prepared for whatever the consultant might say to you. So it does just loom a little bit larger at that point.
Yeah. And you said that you want to be prepared. How do you kind of prepare yourself for those appointments? Is there anything specific that you do?
I don't think there is anything useful you can do, to be honest, but it just inevitably is going to be on your mind a little bit more.
Yeah, absolutely. And have you sort of had any challenges with your active monitoring over the years, or do you feel like it's been quite a sort of well-structured pathway?
I mean, I think it's been reasonably well-structured. I guess the thing that does happen sometimes is you get the blood test back. There may be dozens of different kind of bits of data in that, and sometimes something will be a little bit out of the usual range, and that sort of can sort of plant a question in your mind. Mm-hmm. But I think the thing you have to do then is just ask about it and have a conversation with your consultant and see what it is that they think about it.
And do you feel quite well supported whilst you're on active monitoring? Obviously, a lot of people talk about treatment and how they're well supported throughout treatment. Do you still feel like you're quite well supported on active monitoring?
Yeah, and I think the support is there if you want it, and I don't make use of all of the resources that are available, but I know they're there, and I think that's important.
Amazing. And if you could give one piece of advice to other patients about active monitoring, so whether that be how to manage it, how to prepare for it, what kind of advice would you give?
Well, probably a couple of things. One, I think when you get this kind of diagnosis, I think it's important to have somewhere you can go and find stuff out for yourself, if that's the sort of thing you like to do, which I do. So the WMUK website is really important for that, for me. And the other thing is, just going back to something I said earlier, which is if there is something that comes up which you don't understand or is a bit unexpected, then just ask, and your consultant will answer it as best they can.
And then alternatively, if you had some advice that you could give to healthcare professionals about how they can improve supporting their patients on active monitoring, is there anything that you can think of?
For me, I think just I'm always somebody who likes more information and data rather than less, so I'm always happy to have the full picture.
Amazing. Is there anything else that you'd like to say about your active monitoring experience?
I don't think there is. I think that's it for me.
Amazing. Thank you so much, Tim. I really appreciate that.
Thank you.